All right, let's talk about something that drives so many of us crazy. That nighttime teeth grinding and mouth breathing. If you are just so tired of waking up feeling like you went 10 rounds with your pillow, then you are in the right place.
So let me ask you something. Does this sound familiar? You wake up and your jaw is aching. Your mouth feels like the Sahara Desert. Or you've got this dull headache that just won't quit. Well, those aren't just random annoyances. They're actually clues your body is leaving for you about what's going on while you're supposed to be resting.
So here's our game plan. We're going to figure out what's really going on, and I promise the reason might surprise you. Then we'll get into the good stuff, how to retrain your mouth, master your breathing, and build a toolkit for an amazing night's sleep. Okay, first things first. Let's really understand what we're up against and put a name to the problem.
The fancy medical term for this is bruxism. It's that unconscious, totally out of your control grinding and clenching that happens when you're asleep. And if you're doing it, you are definitely not alone. We're talking about 1 in 10 adults and even more kids. It's super common.
And the signs? Well, they can be pretty harsh. Your dentist might be the first to spot it with worn-down teeth. But you're the one who feels it, right? That nagging pain in your jaw, face, or even your neck, those morning headaches, and just that overall feeling that your sleep wasn't deep or restful at all. And now we get to the big aha moment. Why in the world is our body doing this? The answer is probably not what you're thinking.
For years, we've all just blamed stress and anxiety. And sure, stress definitely doesn't help, but new research is pointing to something way more fundamental. It's often your body's survival instinct kicking in to literally keep you breathing.
This is the key takeaway, right here. When your airway starts to get a little floppy or obstructed while you're sleeping, your brain sounds the alarm. It triggers your jaw muscles to clench and grind to push your jaw forward and pull your tongue out of the way, reopening that airway. So it's not really a bad habit. It's an airway rescue reflex. Your body is trying to save you.
This whole process is often linked to something called upper airway resistance syndrome, or UARS. It's not quite full-blown sleep apnea, but it's a step in that direction. Basically, there's resistance when you breathe, which messes up your sleep quality, yanks you out of deep sleep, and triggers that grind.
And if you want to see the main culprit in action, look at this chart. It's fascinating. The AHI score is just a way to measure how often your airway collapses. For people breathing through their nose, the score is around 27. But look what happens when you breathe through your mouth. The score practically doubles, shooting up past 52. It just goes to show, mouth breathing puts your airway at a much, much higher risk.
So if this is a muscle and reflex issue, that's actually great news. It means we can actively retrain our bodies. Let's jump into the solutions, starting with your oral posture.
The secret weapon here is something called myofunctional therapy. Now, don't let the fancy name fool you. Just think of it as physical therapy for your mouth, tongue, and face. These are simple exercises designed to break old, bad habits and build new, healthy ones. So what's the goal? This right here is what we're shooting for, the proper oral rest posture. Your tongue should be flat against the roof of your mouth. Your lips are gently sealed, your teeth are just slightly apart, not clenched, and the most important part, you're breathing easily through your nose. All right, here's a great exercise to start with. You're going to gently suction your entire tongue, not just the tip, the whole thing, to the roof of your mouth. Keep your lips closed, relax your jaw, and just hold it for about 10 seconds. Do that 10 times. This starts teaching your tongue where it's supposed to live. Next up, let's go after mouth breathing head-on with some lip-sealed training. It's as simple as it sounds. Just lightly press your lips together. The trick is to make sure your jaw stays totally relaxed. Don't clench. Hold it for 10 or 20 seconds and repeat. This helps strengthen the muscles that keep your mouth closed at night. Okay, so we're retraining our muscles. But we also need to retrain our entire nervous system on how it's supposed to breathe, especially as we're trying to wind down for sleep. The difference here is, well, it's night and day. Breathing through your nose activates your body's rest and digest mode. It's calming, it promotes relaxation, it leads to deeper sleep. Breathing through your mouth does the exact opposite. It triggers your fight or flight response, keeping you in this low-grade state of stress even when you're asleep.
Here's the super simple reset you can use anytime, but it's especially powerful before bed. Just sit down, close your mouth, and breathe in through your nose for a count of 4. Then, breathe out slowly through your nose for a longer count of 6. That longer exhale is key to calming your nervous system and reinforcing that nasal breathing pattern.
Now let's get really practical.
Let's put together a toolkit of habits and simple aids that you can literally start using tonight to set yourself up for success.
You know, a few small changes can be absolute game changers. For one, try sleeping on your side. Gravity is not your friend when you're on your back. If you get congested, a simple saline spray or a nasal dilator can work wonders. And yes, mouth taping. It sounds a bit weird, but it can be an amazing tool to gently train your body to keep your mouth closed.
But if you're going to try it, you have to do it safely. And we've got some great advice here from sleep expert Dr. Michael Bruce. He says, don't tape your mouth shut horizontally. Instead, just use a small piece of medical tape and place it vertically over the center of your lips. It's just a gentle reminder, not a seal, so you can still open your mouth easily if you need to.
Okay, all of these strategies we've talked about can be incredibly helpful, but it is so important to know when a problem might be bigger than what you can solve on your own.
So listen up. If your symptoms are more severe, we're talking loud, non-stop snoring, or if your partner has told you that you actually gasp or stop breathing in your sleep, it is time to see a doctor. These are red flags for obstructive sleep apnea, or OSA, and that is a serious medical condition that needs a proper diagnosis.
So let's wrap it all up with this thought. The next time you wake up with that sore jaw, don't just brush it off as a random pain. Ask yourself this question, because there's a very good chance your jaw isn't the problem. It's the messenger, and it's trying to send you a crucial signal about the most important thing you do all night. Breathe.